you may be using the hip hook and experiencing a little bit of numbness on the outside of your leg, or you may have numbness on the outside of your leg and you're looking for some help and may go to the hip hook for some relief. So I wanted to explain a little bit about why that numbness would occur and what is responsible for that. There is a teeny tiny nerve called your lateral femoral cutaneous nerve that runs very near the iliacus. So I'm going to show you a little, give you a little anatomy lesson here. There is a ligament that's called your inguinal ligament that goes from this bone on the front of your pelvis down to your pubic bone. So it's just basically right where my finger is. Right underneath that ligament where it attaches to the bone right here is where that nerve comes out. So there's a little kind of pocket right underneath here where that nerve comes out. So this nerve, the lateral femoral cutaneous nerve, actually travels along the iliacus and then comes all the way up here, goes through the psoas and then through into the spine. So impingement or irritation of the nerve up here can happen really only due to psoas tension, and you can reduce that psoas tension by using the hip hook on your psoas. Occasionally people can have conditions in their spine which can affect that nerve, but typically it happens more locally here. Now, if you imagine this nerve kind of coming through the psoas and say, you know, you got your psoas nice and relaxed, that's great, but it comes down to this little juncture here between that bone, this is the your pelvic bone, and your iliacus. And it has a very small little spot there to go through. Now, if there's any kind of swelling or inflammation in this area, you can imagine that there'd be less space for that nerve to travel. Like swelling, as you probably have experienced before, kind of makes the area compressed. It makes, you know, the structures around it bigger. So then it takes up, that swelling takes up more space and can compress on different structures around that. So imagine that maybe you've used the hip hook for the first time, or you really got in there one day, you know, with the hip hook, and you created some swelling or inflammation. Maybe took it a little bit too hard. So now maybe your anatomy is such that you don't have a lot of space for that nerve, and now you've created more swelling. So now that nerve is getting pressed on and causing that sensation, which for this particular nerve would be a symptom kind of along the outside of your leg. It can feel like a numbness, it can feel like a tingling, it can ache, typically right in this pattern here. So if that nerve got irritated at that juncture, it can be, like I said, because of swelling and irritation. It could even be like swelling, like if you banged into your hip, you know, you were moving furniture and you hit your hip, that even something like that could irritate that nerve. It can also be because your iliacus is so tight, and this is very common. That lateral femoral cutaneous nerve actually can travel through the fascia and connective tissue of the iliacus. So if the iliacus is holding tension, it becomes bigger, takes up more space, and it puts tension on that fascia that surrounds the iliacus. So the tension in the iliacus is actually one of the primary causes of irritation of the lateral femoral cutaneous nerve. Now, you can imagine even going down here, if this area of the iliacus is tight, which is very common, it would make that space where that nerve is going through underneath that ligament very, very small and be compressing on that nerve. Similarly, if the psoas at this lower part is irritated or swollen or tight, that can also make that space very small. And there's a couple more muscles to consider in this inguinal ligament and where that nerve is going through right here. There is also your tensor fascia latae, which is not shown on this model, but it attaches to the outside here. And that nerve, as it comes through there, kind of intertwines a little bit and touches the tensor fascia latae here. And then there's another muscle that's also not shown on this model. It's called sartorius, which attaches right here and then goes diagonally across your body to the inside of your knee. So if there's tension in either of those muscles too, that can contribute to irritation of that nerve. So the question is, there are many different causes for irritation of the lateral femoral cutaneous nerve. But to get at the root of it, you really need to make sure that the muscles around this area are relaxed. That's your iliacus, your psoas, your tensor fascia latae, and your sartorius. And these are all muscles that we talk about as being important to have relaxed. But you want to do that in a way that's not creating irritation. If you go too hard, too fast, or you're really digging in there and you're not giving your body a chance to kind of recover from that use, then you're creating too much swelling, and that can kind of defeat the purpose and make you have two steps back with only one step forward. So it's important that when you're approaching using the hip hook, whether it's to resolve this condition or as you've been using the hip hook in general, to make sure that you use the hip hook in a really gentle way. So one recommendation that we give everyone is to use the hip hook up against the wall, because if you're up against the wall and you can lean into the hip hook, you can modulate how much pressure you're putting and do it nice and gently, and gradually release that muscle over time. The other thing is the placement of the hip hook when you do use the hip hook. We talked about this inguinal ligament here. On your own body, that is, the bone is right here, and then you have this crease here where your hip bends. That is where your inguinal ligament is. So right where that crease is where you want to not be poking with the hip hook. So if you're taking the hip hook and you're poking, or using it all along that inguinal ligament in here, you're going to be irritating that ligament and those structures we just talked about, and creating inflammation and making that nerve potentially get irritated. So you want to think about using more rotation to get into that area. So using the hip hook by rotating it or bringing it up and down in this area, but really staying above that crease so you're not irritating the inguinal ligament. Similarly, when you're finding that spot here, the ASIS, or that bony part that sticks out, if you go right inside that with the hip hook, but you don't go in enough, sometimes you can just kind of push directly on that ligament at its attachment point. So you want to make sure that you're going in maybe, a centimeter to an inch, so that you're getting more of the muscle and less where that ligament attaches to the bone. The other thing that you want to think about too is that if you've had an experience, whether it's before using the hip hook or while using the hip hook, where you've created some numbness, you not only want to decrease the amount of pressure that you're using so that you can gently work your way in it, but you also might want to take a break and get that inflammation down. Anti-inflammatory methods such as ice to this area right at the front here will help that pain down your leg, or that nerve sensation down your leg. Icing for 10-15 minutes max, once an hour at most, is what's most effective at decreasing inflammation. If you do it for more than that, that will kind of negate the effects of ice. Similarly, using any anti-inflammatory methods, whether it's oral anti-inflammatory methods or topical anti-inflammatory methods, can be really useful for getting that to calm down. But the thing is, you don't want to abandon using the hip hook to get the release in the iliacus and the psoas, because ultimately it's tension there that is responsible for putting you in this situation in the first place. So, just modulating and decreasing the amount of intensity at which you're working with the hip hook by using the wall, by maybe giving yourself 2 or 3 breaks in between each sessions, so that you can get your body to relax that muscle over time in a gentle way that doesn't cause too much inflammation. So one more thing that I want to mention too, we talked earlier about the TFL and the sartorius, and those muscles are muscles that are worth addressing. Sartorius is best addressed by using a foam roller and just finding the tight spots in your quad and the sartorius as it goes across with a foam roller. And then the TFL is best using a small lacrosse ball. And I have video specific to lying on that on the outside of your hip to release the TFL. If those muscles are tight and not being addressed, in addition to the iliacus, that could be a piece of the puzzle of why maybe you're not getting better. And then one more thing I wanted to address around this area, this groin area. It's very common to feel like this is where your pain is, right? And this is a lot of people really want to dig in to that groin area right here where that inguinal ligament is. And so part of what might have gotten you in the situation in the first place is that desire to put pressure right on that ligament. And that again creates irritation and then causes this problem. So, to resolve that desire to want to press here, you have to really work on the muscle above and below the ligament. As you can see, if the ligament is right here, you have all this area down here where the muscle is, and you have all this area up here where the muscle is. So working above that inguinal ligament at different spots in the muscle is going to help this particular spot that is bothering you the most. Similarly, using the hip hook at an angle with an angle down towards your legs can help you get underneath that inguinal ligament and get that spot. And then using the bigger ball, which isn't as direct pressure, but using that below the inguinal ligament, more kind of on your upper thigh. So if here's that groin, I can use here's that diagonal angle here, that crease. I can use the bigger ball down here and lie on my stomach and put pressure here or up against the wall, which will get at that lower part of the muscle of the psoas, but not necessarily pressing right on that groin spot or right on that fold. So I hope all this information is helpful to you to really understand what's happening with that lateral femoral cutaneous nerve and why it's creating that numbness and what you can do to resolve that.